everybody, and welcome. I'm Christine Salas, the HTPA Community Director, and I want to welcome you all to our Healer Development Series to deepen your healing touch practice. Today's topic is on end of life, and we have an amazing panel today of practitioners and instructors to share their knowledge, skills, and expertise with you on working with clients at end of life. A few things I want to mention before we get started. We are recording this event, so I ask all of you listeners to please mute yourselves. The recording will be available on the HTPA member website, usually within about a week or so, and we will also be emailing the recording out to those of you that registered for the event. We will save questions for the end, so I will let you know when we're at that part of our program, and you can put your questions into the chat box, and we will try to get to as many of your questions in the time that we have. And now to introduce our lovely panelists. So we have Donna Ackerman. Donna is an energy medicine practitioner with over 21 years of experience. She also holds nursing certifications in the fields of holistic nursing, oncology, and hospice and palliative care. Donna has devoted her life's work to healing touch and energy medicine practices and to assisting others with the healing journey. Donna is a Healing Touch certified practitioner and instructor, currently teaching levels 1 and 2, as well as edits the Healing Touch curriculum and notebooks. She is a board certified holistic nurse, certified hospice and palliative nurse, oncology certified nurse, certified vibrational sound practitioner, certified integrative reflexologist, and is the owner of Soft Landing Healing, a healing arts practice. She provides healing touch to clients in her own energy medicine practice, as well as provides healing touch to hospice patients. Welcome, Donna. Glad to have you here. And then we have Melinda Chichester. Melinda is a Healing Touch certified practitioner, instructor, mentor, and end-of-life doula. Melinda works for ProMedica Hospice as their team and volunteer coordinator. She is a death educator focusing on the physical, emotional, mental, spiritual, and energetic aspects of death. Melinda is a self-starter with high enthusiasm, and she strives to motivate people and educate the community on the benefits of self-care. In her spare time and for self-care, Melinda creates custom pendulums, helping you to access prosperity, power, and possibilities. She is published in several e-periodicals, sharing the benefits of energy medicine at end of life. In her work, Melinda has concluded that the hara is the soul's transport system, supporting each person's unique energetic expression back to divine source. Melinda lives in West Grove, Pennsylvania, and recently welcomed her first grandbaby into the family. Thanks for being here, Melinda. And then we have Dan Curran. Dan is a Healing Touch certified practitioner, instructor in training, and Reiki master and teacher. He started his Healing Touch journey in 2016. However, Dan initially transitioned from a career as an engineer and business owner to deepen his connection with healing work and the healing arts in 2014, initially with a dive into shamanic practices, reflexology, cranial sacral therapy, and Reiki. He has a private practice and also works with a local hospice agency and a cancer support center to bring healing touch to those actively transitioning and their families, and to cancer patients during their chemotherapy treatments. When not supporting clients, teaching classes, doing lapidary work, or studying energy systems, you can find Dan and his wife on a trail somewhere. Thanks for being here, Dan. And then we have Angelika. Angelika is an integrated energy therapist and a spiritual guide and has been in private practice since the year 2003. Her divine purpose is to guide her clients into a life of healing, the body, mind, and spirit, to live with their heart's intelligence as an embodied soul here on earth. She is passionate about guiding people home to their hearts to embrace self-love. Once healed into self-love, the client's passion and purpose is awakened and life begins to realign itself in accordance with their soul's blueprint. Their joy for life is awakened. Angelika tailors each session according to her client's needs, choosing from modalities including healing touch, integrated energy therapy, crystalline heart dimensional healing, light language sound healing, and past life regression. Thanks for being here, Angelika. And finally, we have Linnie Thomas. Linnie is an award-winning author of the Encyclopedia of Energy Medicine, Laws Governing Energy Medicine Practitioners, Pioneers in Healing Touch, and There Is No Hell. A certified spiritual healer, diplomat of Earth Stewardship, an ordained minister with the Assembly of Spiritual Healers and Earth Stewards, she is now a full-time author, student, and instructor in the healing, metaphysical, and spiritual fields. Linnie holds certification both as a practitioner and an instructor with healing touch. She has studied more than 100 energy healing therapies and conducts workshops and lectures about energy healing and communication with spirit guides. Thanks for being here, Linnie. So, wow, you could see we have a lot of experience here on this call, and I'm so looking forward to hearing everything they have to share with us regarding working with end-of-life clients. So I'm going to let them each share a little bit more about their experience working with clients with end-of-life. And then we'll move on to some questions that we can have them answer for us. So Donna, would you mind sharing a little bit more about your experience with end-of-life clients?
Well, for those of you that weren't on the call when we first started earlier with the presenters today or speakers today, my interest in this all started back in 2000 after the loss of my first husband, Shelton. And I moved back to South Florida and started nursing school. And when I graduated nursing school, I was taken directly onto an oncology ward where we held 4 suites for hospice patients. And most of the senior nurses on staff did not want to accept those assignments for those hospice patients. And I'm experiencing what I went through with my husband at end of life care, which was the most beautiful experience. Even though it was tragic, it was the most beautiful experience. Really kind of honed my direction and my journey as to where I was going to go as I restarted a new life as a young woman. And that's where my passion has always been, was with end of life care. And then going through, of course, Healing Touch program starting in November of 2000 and opening myself back up to experiences that I had when I was a child, but not knowing what those experiences truly were. Really kind of opened my whole world. And it's just meant so much to me. And, you know, it's a gift to be able to help and an honor to be able to help people through end of life care. I've always said that one of the things that we in the United States forgot to teach when we taught health education to our kids, you know, we teach them how to have safe sex and how to bring babies into this world, but we don't teach them that death and dying is a natural part of who we are as energetic beings having a human experience on this earthly plane. And so my passion is there. I'm fortunate to be able to work with a hospice agency locally here in Sedona to see their clientele and to work with them. We have some that are on hospice for, several months, and I get the phone calls that they're going to be leaving this earthly plane very shortly. And it's an honor to help them through that when they're a little bit more together with it. And it's an honor to help them when they're in that transition stage where they're still floating between being here in the physical plane and then transitioning. So it's my joy.
Thank you, Donna.
To be here.
And Melinda, would you share a little bit more? Oh, you're on mute, Melinda.
Thank you. So I had my first exposure to hospice back in 1990 when my aunt, we had her in our home under hospice care. And I had, one of the most remarkable experiences with her. And sadly, I had the worst experience as a family member who was blamed for the death of my aunt. And so I knew in that moment that I wanted to advocate for those that were left behind. And so it took years. I never found, I went back, I found hospice again in 2008, where Healing Touch found me. And I knew in that moment I wanted to bring energy medicine to end of life. And so I got certified in 2011. And then I never stopped. And so I was fortunate enough to be in that environment teaching, or not teaching, just bringing energy medicine to those at end of life. And then I was fortunate to kind of go out and start educating myself on more advanced energy work, whatever came across my path. And then I was fortunate enough to come back to the same area 2 years ago. And I'm back in hospice bringing the advanced work that I learned. And I absolutely am deeply passionate about bringing energy medicine to end of life, whether it's a spot technique, whether it's an advanced technique, or just holding a healing presence. And I do want to share, we were talking about it earlier, it is a calling to want to be in this space with those that are transitioning. So my intention is to bring energy medicine to this hospice and to our patients. And so I feel like I've kind of come full circle being able to learn this work in hospice, and now I get to bring it back again. So thanks for inviting me. Glad to be here.
Thanks, Melinda. And Angelika, will you share a little bit more?
Yes, like Donna, my husband passed away in 2000, and that's what got me on the path. And that's when I was guided to Healing Touch. And I still recall a friend inviting me to take Healing Touch. And I found the techniques in level 1 of Healing Touch so profound to help me to heal from the grief that I was feeling. And so, of course, I then decided to continue on the path. And then it really opened me up to working in hospice, in working in hospital setting with cancer patients, all sort of who are either going through treatment or at end stage of the Good Shepherd Center that was really end stage the last 3 months of their life. And I can tell you that I learned so much from my clients, because people at that stage, they drop all their barriers and they really open up their hearts and just become who they are. And so the relationships, the healing, that it was really reciprocal. It was deep, it was pure, it was whole. And it really became such an honor to assist people to either go to the other side or not. Some of them didn't. And I always remember one particular patient who when you're new at doing something, when you're new, you're excited and you really want to. And I'm going way back because I started in 2000. You're excited about helping people to heal. And I remember this one particular patient always so looking forward to seeing me. And when I walked in the door that one day, he said, I think we need to have a talk. And I said, what's up? Like, what's going on? And he said, you are such a beautiful soul, and I so enjoy our time together. But I want you to remember one thing. Sometimes healing is not living. Sometimes healing is dying. And I have to say that stayed with me for my entire life. And so it really is not about going in to fix anyone or try to make them better or try. It's really about what I think Linnie or someone said, just being with them and being in the energy and providing what's needed in that moment for that particular person. So it is now for me something that is not my entire sort of focus. It is something that I decided that I would do in balance. So the majority of the clients that I now work with are cancer patients that may or may not be. Some of them do pass and some of them go on to live lengthy lives. So it's kind of a transition and a balance for me in my life, not to focus entirely on working with people at end stage of life. But I can tell you it's very near and dear to my heart, and Healing Touch has helped me to find my life and live this beautiful journey. Yeah.
Thank you, Angelika.
You're welcome.
And Dan, would you tell us a little more?
Yeah, sure. So compared to my esteemed colleagues here on the panel, I feel like I'm kind of a newbie here, at least with some of my recent experiences. So I'm not a big fan of labels, but I am a perpetual learner. So they say that when the student is ready, the teacher shows up. And wow, I've had teachers from all over the world show up for me, which is really quite amazing. Some of the, just so I can share some of my learning experiences and what I've done will help lend a little bit of credibility to some of the work I do. A lot of it, I started out with a shamanic practice before I came to Healing Touch. So that's where a lot of my learning and experiences have come in from. I've worked with Kitty Edwards, with the Living and Dying Consciously program in Boulder. And so the shamanic work there is called psychopomp, which means soul guide. In the Celtic tradition, it's called anamkara, which is soul friend. So in the hospice industry and end of life, what we try to do is be a guide or a friend for those who are transitioning. I've also learned from the Hopi, Lakota, Navajo, Tibetan Rinpoche, an Egyptian healer, Maasai healer, and most importantly, from elders in the Sacred Valley of Peru. That all being said, Healing Touch is a beautiful, comprehensive, inclusive modality that is easily accessible and brings together many energy medicine techniques. I started my journey back in 2010 with a severe medical event, a near-death experience. And then all of a sudden, I got to figure out who I was, and I started to recognize some of the gifts that I have to share with people. I see a lot of end-of-life clients with hospice. I work with them, I work with their families, I work with their caregivers, which is most important. I've discovered that, people in the end-of-life scenario, they're going to transition whether we're there or not. Their soul already knows how to do this. They've been doing it, over and over and over again. I feel it's our responsibility at end of life to bring peace, to help them clear, help them get ready for the transition. But just as important, to help those left behind, like Melinda said. That's why we're here, and it's so comforting and rewarding to be able to do that work. Part of what we do is sacred listening at the end. So we let the people say what's on their minds, and without judgment, just, hold space for them. And all you people here that have joined us in this webinar, it's a calling. Nobody grows up hoping to work in hospice someday. So welcome. It's a beautiful, rewarding part of your path. I think that's about all I got for now. Thanks, Christine. And thank you for putting this all together for us.
Thanks, Dan. And Linnie, will you share a little bit more about your background?
Well, my first experience with death occurred when I was 18, and it was my grandfather had passed away. My dad refused to let us children go to the hospital. He didn't want us exposed to the tragedy. So when the funeral happened, and I walked into the building, and it was filled with light, absolutely filled with this golden white light everywhere. And I could hear this ethereal singing, and there was this feeling of great joy. So I'm sitting there with family everywhere. My grandmothers and some of the family were crying, and my dad was very stoic and stern and sad looking. And I'm feeling this incredible joy, thinking I'm some kind of a nut. What's going on? Have I lost my mind? But I did share it later with my mother, and she said, "Oh, that's wonderful. That's just what I needed to hear." And it opened the doors right then that death is a different experience than what I had been told my whole life long. When I got into Healing Touch, which is in 1997, I took my first class. I'm trying to remember what my first experience was with someone who had passed over. They're all so unique and different, and some stories stand out in my mind and more than others. But what I'm finding is that each one is very unique and very different. And doing recording the documentation, you're telling the story of this wonderful time in a person's life. And I don't go so much into the details of centering and grounding and stuff as to what I'm seeing and feeling while this is happening. And because I'm kinesthetic, I feel energetically more than I do see things. I've found that it's one of the most wonderful, enjoyable, gratifying. I've run out beautiful experiences, and I love working in this field very, very much. Everybody said so many different things, but that we're all basically saying the same thing. I think you might want to move on to other things because I'd be just reiterating what everybody else has said.
Thank you, Linnie. Okay. So our first question is about intake, assessment, and energetic patterns. And so we're wanting to know, is there anything different that you do with your intake and assessment process for an end-of-life client? And are there any common kind of intake, assessment, or energetic patterns that you're finding in clients at end of life? And Linnie, I'll ask you to share with us a little bit about that.
Okay. Like I said just a few minutes ago, when I'm doing that intake, I'm aware that I'm telling the story of a very fascinating, marvelous experience in someone's life. So some of my intake will include that all the way along. And as I document each session, they're never the same. The person is always in a different space when I go to see them. But the assessment is where it gets really fascinating for me. And I have a story for assessment. I was working with a woman. She was a Healing Touch certified practitioner. And we had been working together for about 6 weeks. And then she had a heart attack, and her sons called me. They didn't know what to do. So we were in her bedroom. The boys were on one side of the bed and I was on the other. And she had not told the boys about what energy healing was all about. So I began to demonstrate an assessment, and I brought my hands down, and I was about halfway down her body when I felt this rippling effect, like somebody was pulling a sheet out from underneath my hands. And I knew instantly what was happening. And it was her gift to me. She left her body while my hands were in her field, and I felt her go. And I looked at her and I saw that she had stopped breathing, but it was several minutes before the boys realized that she had stopped breathing. And I let them find it on their own rather than my telling them that it had happened, which they appreciated very much too, because suddenly they were a part of what was going on in their awareness of what was happening. So each time I do an assessment, there's something different going on. The chakras, the bottom three, get smaller and weaker as the person gets close to their time. When this person left, the crown chakra was huge and went up clear past the ceiling, and it was iridescent and full of life and color. It was beautiful to see, and for somebody who's kinesthetic, it was delightful for me to be able to see it at that time. Most of the time I've noticed that the crown chakra is usually huge at the closer we get to time. So in doing the assessment, I can get an idea of where the person is at, which is very, very important. And the energetic patterns change. There's a difference in the field. The lower field becomes more soft, more pliable, for lack of a better word, weaker. It's not as strong, it's not as evident. Whereas as you go up the body, it becomes more strong. And at the crown, it's an amazing thing. Melinda, you have a lot of experience with this too. Do you have some comments? Because I know we think a lot alike.
Yeah, it's interesting. I find assessment to be the key when I'm certainly starting with a end-of-life patient. The chakra systems we know are the issues system. And so it tells me where there might be some compromises, right? Whether or not that's similar to their diagnosis or not. I assess the field. I want to know how expanded or contracted the field is. And I do most of my assessment in the beginning, not towards the end. I was fascinated what you were saying about the assessment at the end. I'm not nearly drawn to the after as I am the before. So I'm glad we paired up. And so the field to me tells me if it's very contracted, they may be in some type of pain, physically, emotionally, mentally, or spiritually. If they're fully expanded, like extremely expanded, they may be visiting the other side. I have seen where the patient, the dying person, will experience being in their body and out of body. And so I see that with an assessment. And then I also assess the hara. We learn a lot about the hara. We know how to tap into the hara and how to do the hara meditation. I've been blessed to be able to do some advanced energy techniques in the hara. I found that those that are struggling at end of life, normally it means they're holding on to maybe a trauma that is keeping them from having the ability to leave their body. I mean, eventually they will. But when I'm called in and I see that the hara has been affected, there's no flow, then I like to work in that hara system. And I do have some book and some information to give you later on in this call. And so the hara to me has been when that hara is flowing and open and expanded, they seem to know where they're going. And so I find that the passing is almost an effortless effort when before they were really struggling. And then I also assess the core star, where that's how we bring our light to the world. And so I want to make sure all of the systems are open and flowing so the client has the ability to just be in that quiet space of not feeling the body. And I have an example why the assessment was so enlightening for me. So I had a brother and sister. Brother was on hospice and he was nonverbal and struggling with immense pain. Sister didn't want to medicate him because she was having moments of where she knew her brother was there, and she wanted those moments because they were special for her. And so through my assessment, and I would share them with her after each session, I would indicate to her when he was fully expanded and feeling and in that space of going to that inward work that has to happen at end of life. But when he was in his body and in pain, he wasn't able to kind of access that transition that he needed to. And through my assessment, I was able to help the sister to identify it was time to increase his pain meds. Because remember, we don't treat physically, we treat energetically. And so my assessment helped me to identify and share with her, listen, he is really contracted. There's no flow in his energy because he's in his body and he's in pain. And so that was just a wealth of information for me. At end of life, I don't necessarily assess the chakras. I guess I'm so tapped into the spiritual aspect of the transition. I'm usually communicating with either the families around or even the dying patient, right? So I feel like I'm almost in the experience, and I kind of forget to do the assessment. But I do find it is critical. And there was a time where I was doing treatments and I walked into this gentleman's room, and there was a moment where I didn't need to do a thing. He knew what he was doing. He was in that expanded state. You knew that he was not in the room or in his body because the room was, I felt like I had stepped into a sacred environment. And I guess for anyone who does this work, we don't always have to do something. Sometimes we just have to be a healing presence while they're in that transition themselves. So I find assessment to be a really big tool for me in the beginning when I meet my clients.
Great. Thank you, Melinda. So next, I want to have a few of you share about just the healing touch techniques that you use commonly with clients at end of life, and kind of your rationale for using those techniques, why you find them, more effective than others. And then particularly with end of life, if you're involving family members in those sessions when you're doing the techniques. And Donna, would you start us off in sharing a little bit?
Sure. So going back to our original discussion, and as was mentioned previously, death is a form of healing. And when someone is terminally ill or at the end of their life, their spirit or energy body needs to be nurtured. There's an energetic shift that has to happen in order for them to pass peacefully. When they are relaxed, when the energetic and physical bodies are relaxed, they're able to have effortless effort and be at peace with this transition. One of my go-tos, and it's not a one size fits all, but the majority of the techniques that I use with my patients is the chakra spread. And also, as Melinda mentioned, the horror work. And I find it to be, just really profound work. I do invite family members, if they are in the room with the patient at the time. I do invite family members in. I have taught family members how to do a chakra spread, and how to hold that sacred space for their loved one, and to not be fearful of watching the transitions that will occur as the patient is transitioning off out of their body. And again, it's a matter of meeting patients where they are. As I mentioned earlier, I do have some patients who aren't as close to end of life, but they are terminally ill. And so I will meet their needs where they are. So I can use the whole toolbox that we've learned in healing touch. And I bring those techniques in, and I do teach things to either the patient if they're able to do so and want to participate, but also to the family members and also to the staff that's there. One of the assisted living facilities that I work at here in Sedona, the staff is very interested in the work that I do. And they are the ones that actually call the hospice nurses in and say, can you call Donna and get her to come and see our patients, because this one is coming near towards end of life, or this one is not so close, but is experiencing a lot of pain. And no matter what we're doing for them, it's not working. And so it's, you know, it's beautiful that we are capable of doing this. And that's pretty much where I go with everything. So.
Great, thank you. And Angelika, could you tell us a little bit about the techniques you use?
Yes, I think beyond technique, first, what I want to say is what's utmost important is the essence of love, so that, you know, we're fully centered and grounded and clear, and that what we're bringing to our patient, our client, is this energy of love. And my go-to is also the chakra spread. It's such a beautiful technique. It works through the aura. It opens those chakras. It works through the aura. There's a gentleness to it. And I think that's the other thing, is sometimes less is better. It's not always good to do lengthy sessions. It's better to do short little sessions. The client can't receive too much. It could be overwhelming. And there's just a beauty. And what I want to say is, often I've done this. I've gone into hospital setting where family members were sitting with their loved ones. And often these family members were not so much aware about energy work or spiritual healing or healing touch or any other modalities. So, and they would often say, would you like us to leave? And I would invite them to stay. And they would stay, and they would sit, and they would watch, and they would be moved to tears. So I like to say that, you know, these are not people who are even aware of energy or chakras or any of that, and yet they could feel it. They could feel the love. They could feel the energy. They could feel the peace. And I find that with the chakra spread, really what it does is it brings that patient to a state of peace, so they can pass over in that state, letting go of all that they've been holding on to, all the regrets they might have about what they did or didn't do in their life, what they didn't say. They're able to find that inner peace and then let go. So it was always, after the fact, the family members, we would go outside the hospital room, and they would say, we have to talk to you. And they would say, you know, I don't know what you did. I don't understand it. It doesn't make any sense to me, but thank you. And I stress, these are people that aren't really into knowing a lot about energy and healing. So I highly recommend that family members be a part of that process, because they are also receiving, even though you're working on that patient, they are also receiving a lot of healing and getting themselves into the state of peace to be ready to let go. Yeah.
Yeah, thank you. And Melinda, do you want to share a little bit?
Yeah, I mean, just to tag with the two ladies, you know, I too, the chakra spread is probably my go-to, especially dependent on when I'm called in to bring the energy work to that particular client in that situation. So it can be, you know, weeks before, it can be at the time of death, right? And so the chakra spread, what it does is, as Angelika was saying, it really does create the most sacred environment that I have ever experienced. And I think that's what I was sharing previously about knowing when you walk into a room or into your patient's room and you feel that sacredness. And that literally is them being connected to that other side. Like energy finds like energy. We say that all the time. And so my advanced work with the Hara, I get a lot more Hara patients. I'm usually called in for those that are struggling. And so I find that working in the Hara energy, which is a very high vibration for us. And I do want to recommend a book. Christine, I can put it in the chat by Kathy Sinnott, Transformation. She's got information about the Hara. And Amelia Vogler is also offering a free intro on Hara, which is going to lead into a Hara class. And so if you're interested in advancing your energy knowledge around the Hara, I would highly recommend, you find your path in this work with the Hara. With the chakra spread, I've had 2 times in my work that I was in with the patient when they transitioned during the chakra spread. And I want to offer this knowing, because I didn't know at the time. When the first time the person passed, I was midstream doing the chakra spread and I stopped. And someone shared with me that if someone should pass in the middle of a chakra spread, continue until the technique is complete. The soul is still there. And so just continue with that until you finish. So I hadn't known that at the time. And so that was a wealth of information. The second one was actually my father. And so I'll probably tear up, but I literally was doing the last handhold and he took his last breath. And if you are able to be in the energy of a client when that transition happens, I'll tell you, that's the gift. I think that's why we do the work, because we really are drawn to the magic of the energy at end of life. It's Linnie, you said the same thing. You get excited about this work. It's like birthing a soul into this life. Look at the joy we have. We don't educate, or people are afraid to know that there is joy when the soul transitions out of this life. And so I would love it if we all knew that birthing a soul into into eternity, it doesn't get any better. And so my 2, the chakra spread is absolutely one of my favorite go-tos with end of life. So. And would you like me to put that information in the chat for the book and okay.
That would be great. Thank you. Yes, resources are great to share. And thank you for sharing such a personal experience, Melinda. Beautiful. So next, to talk a little bit about kind of how often and how long you're typically seeing clients at end of life. And kind of the duration of the sessions. I know someone mentioned, doing kind of shorter sessions, but Dan, if you could maybe share a little bit about that.
Oh yeah, sure, of course, thank you. So frequency, what an interesting word. So how often or how high? How often, this depends greatly on what stage the person is in when we see them. For example, an 11th hour or actively dying or transitioning, it could be just one-time visit, and it could be for as long as it takes or for as long as you can give it, knowing that however much time you can give it is exactly enough. People can and will die alone, and with or without us being there physically. We all know that remote sessions work. We can be remote in the chair across the room, working with them. The soul knows what to do and how to do it. So please don't take on the responsibility of trying to be or needing to be there at the moment of transition, even though, as Melinda said, that is just beautiful. Sometimes the patient or the person doesn't want anyone there because it's their moment. Quite often that happens. Everybody will leave the room and the person will transition. So in my experience, we all need a break from holding vigil. And this is when a lot of people cross. It's just really comforting to the person, to their family, to their caregivers, and yes, to their pets, to know that they have a friend, a soul friend, an Anamkara, or a soul guide that can energetically be there in person or remotely to guide, hold sacred space, bring peace to the whole process. Sometimes end of lives can be months away. The These sessions are as needed and allow the client to get their energetic body in order. This involves ritual, ceremony, clearing, cleansing, releasing, and of course, sacred listening without judgment. This is where we as energy practitioners get to witness for them and offer unconditional love. So the other part of frequency is how high should our frequency or vibration be? If you're intentionally present, intentionally loving, kind, and compassionate, then heart-centered, high frequency, high vibration is achieved. So before you go in, create your own personal ritual, ceremony, or method that brings you into the moment and leaves your stuff outside. A prayer, a meditation or mantra, a modified chelation even, anything that brings you into the being of light, love, and peace. Don't forget to leave your stuff or their stuff inside. So when you're done with a session, make sure you disconnect and don't take their stuff with you. That's really important. So whatever your technique or method, and remember that we learn the foundation of the techniques in healing touch, but it's really more of an art form. Everybody does it their own way. And it's, you know when it's right. And if you're doing it with love, then it'll be right. So, whatever your method of disconnecting and separating your energetic body and grounding, that needs to be done, not only for the client, but for the place. So we need to separate from the room or the place, whatever the sacred area is that they're transitioning in.
I'm in a class. What's up? Oh, sorry.
Separate from the family and from the caregiver. So what's yours is yours, and what's mine is mine. That's kind of
Okay.
They can't clean it.
What?
They can't clean it. It's dry clean only. They can't put any chemicals on it.
Oh, no.
I'm good.
So my couch is fucking ruined.
Okay.
Trying to mute them. Okay. Thank you, Dan.
Yep.
And Donna, if you want to add to anything that Dan shared.
Well, Dan, I want to thank you for bringing the attention to the many meanings of the word frequency.
Mm-hmm.
That's awesome. So thank you for taking the lead on that. As far as frequency is concerned, in addition to what Dan had to say about the frequency that we are holding, again, it goes back to, it depends upon where the individual is at in their end of life transition as to how often I will go see them. It's depending upon the family members. It's dependent upon the facility that I'm working with, the nursing staff request, and where they're at. Again, as I think it was Linnie mentioned, less is more. You don't want to pull in that whole toolbox that you have and spend 3 hours in someone's room trying to help them transition. Trust your inner guidance. You're doing this work. You're there for a reason, and you will be guided properly as to what technique is the correct technique, and how often you're gonna, you will need to be there. I thought I was going to be able to do this without doing this, but an example of this is when my mother was passing back in 2011. My siblings, they felt the need to be in the room with my mother the entire time, along with my nieces. And I had come in from Maryland, and I went into the room and I saw how many people were there. So with my siblings' permission, I performed a chakra spread on my mother, as they all stayed in the room and watched me do it. And they were in awe of how they saw the changes in her, how her breathing pattern changed, and her facial expressions became, much more peaceful. And so that night I decided that I was going to go back to my sister's house and spend the night. fully expecting that I would get a call in the middle of the night stating that my mother had passed. And I called my sister the next morning, and she said, no, Donna, she's as she was when you worked on her. And I said, how many of you are there? And they were all still there. And I said, Kathy, Mama is not going to leave with all of you in that room. She loved to give Christmas presents, but she didn't like to receive them. There is no way that she's going to let you see her lying there and take her last breath. So please meet me downstairs in the hospital and let's see where this goes. So my sister met me downstairs, and a few minutes later, my brother came down. 5 minutes after my brother finally came downstairs, he was the last person with my mother. The nursing staff called and said, she's just transitioned, you may come back up. And it was just confirmation that, you know, that's who she was. And it was confirmation to them to understand that this is what had to happen in order for her to leave. Because as we all know, everybody wants, okay, there's two schools of thought here. I don't want them to leave. Please, why is this happening? Or why are they hanging on for so long? They seem to be suffering. It's not for us to determine that. It's for the individual that's going through this process. It's their connection with their divine source, whatever that source is, as to when they're actually going to transition. We can assist them along and open them up, which is the beauty of the chakra spread, to help open them up to that spiritual connection so that they can receive the guidance and the wisdom and the acceptance of, yes, it's a, you know, come with us, we're going to take you along. And you know, in the end, all we take with us is love. So when we approach these clients at end of life, that's who we are when we walk in that room. We are centered, we are grounded, and we are tuned to that loving presence to assist them along that journey.
Thank you, Donna. And now a little bit about kind of common observations and evaluations that you find when working with these types of clients during or after the sessions. And Linnie, would you share a little bit?
There we go. Okay, I'm so excited about this topic that I forget the technical stuff. Something that I'd like to bring up here under observations is I've had several clients who are in a coma and they have left their body and moved on before the body has stopped. And it's important to acknowledge that. The family may not understand it, but as practitioners, we can. And when that happened, my first experience was with my stepfather. He left his body 2 days before his body finally shut down. And I finally asked his body, why are you still functioning? You know, the master's gone. Well, he had led such a healthy life that the individual parts of his body weren't quite ready to let go themselves. So it's a little bit more complex than just the soul leaving the body. The individual body parts have some say in this too, sometimes. That one really awakened it. I've held 2 dogs that were being put down, and the vet gave each dog a shot to make it sleepy and relax before it got the final shot. And in both cases, I felt the dog leave its body before it got that final shot. So that validated some of what I had experienced with my stepfather. And then I've noticed it with other clients as well. But these are usually seriously ill people who've been in a coma for a while. And all of a sudden, it's like the room is empty. They're just not there. I don't know how else to explain it. I've sat by myself beside the body of a person who's making their transition, known that the person is long gone, but the body is still functioning. So that is one observation you may run into. You may not, but And perhaps because I'm comfortable with it, I've seen it several times. Another thing about observations and evaluations is of the family and friends who are there. I've been known several times to do the chakra spread on a family member who's having a very difficult time knowing that there's going to be a transition in his or her relationship with the person who is dying. And by doing the chakra spread on them, it helps them relax more and be a part of the process, and some of the anxiety leaves. Sometimes I do mind clearing on family members that are really uptight and just can't handle the situation. Sometimes just simply doing hands in motion around the head and the heart region will help. So those are techniques I realize, but it's also what I'm wanting to say here in observations and evaluations is it's not just the client that we're usually working with at that point in time. The whole family is being treated in a way. Donna, have you got some more comments on that?
As I unmute myself, yes, Linnie. As Linnie mentioned, you know, I've had several family members when they have been present when doing the chakra spread, that, you know, the chakra spread not only does work on the individual that you are working with, but it is also working to change the energy of the field itself in the room, as well as the other individuals that are sitting there. And there's been a lot of feedback from family members and or those present in the room when this is being done, that they do feel a change in their own energetic selves, and that they do feel more at peace, and how beautiful it was to watch, to be able to witness the changes in their dying loved one. One of my personal experiences, which is really what got me into working with hospice, was when my first husband died. The reason that I was lying in bed with him in the hospital bed when he transitioned, and I knew he had transitioned because all of a sudden I had this sense of movement through the right side of my body, and this tremendous amount of heat came in and then exited out the left side of my body. And his nurse was standing over the bed, and I opened my eyes and I looked up, and she said, "Honey, he's just left." And I said, "Oh, I know he has. He just passed through my body." And it was the most profound experience I had ever had in my life. And out of that tragedy is what brought me to all of this beautiful work. And those are the types of experiences, if you're open to it, may reveal themselves and may reveal to other family members. I had a client recently at the assisted living facility. I was called in to work with the client, and she was very near end of life. And so I ran into the daughter, and the other family members came in, and we all collectively, some of them were Reiki practitioners, and we all collectively stayed around the patient's bed and held sacred space for her. And I did the chakra spread with her. And I watched as she transitioned up out of the body. And ironically, over on the left side of the room by her bed was this beautiful whimsical dress. This woman was so full of color and life and everything, but there was this beautiful whimsical dress. And as she transitioned, she came up and out and went straight over to that side of the room where the dress was. And after she took her last breath, the daughter looked at me and she said, "Well, but where did she go?" And knowing the daughter as well as I did, I explained where she was. And she was so excited and so thrilled to know that her mom had transitioned in such a beautiful way. And the family members were just very grateful, and it was a beautiful experience. And not all of them are going to be like that. So please understand that. Just embrace it and trust that when you're there and you're working with these clients and these patients, sorry, I go back and forth because I do have clients and I do have patients. Trust that the guidance that you're receiving is what is needed at that moment in time. You are in this very sacred, loving space assisting someone through the most beautiful part of life, in addition to birth. But this is a part of who we are and what's going to happen to us. So embrace it and trust it. Don't be afraid of it. Be open to what's there. As Linnie said earlier, trust your first intuition. Otherwise, secondly, your ego is going to step in. There's no ego involved in this whatsoever.
I'd like to step in. You reminded me of an experience I had. Thank you, Donna. I got the impression that my client needed connection somehow with the family that was in the room. And there were 17 of them. It was a very crowded, small hospital room. And when I completed the chakra spread and I'm trying to think, was a family member, I can't remember, I think it was the mother of the person who was passing. Anyway, she had held the other hand. And so she put a hand on top of mine, and I had everyone in the room put a hand on top. No weight allowed. I made sure that there was no weight on my person, and I had everyone express love through their hand to that person. There wasn't a dry eye in the room. Then I said, okay, it's time to gently move off. And it was about an hour later, the person passed. But there was this feeling of completion for everyone. And sometimes that's part of the observation and evaluation that you need to make. When is there a time for completion for everyone? How can you help service all the people that are involved? Because like you said, the chakra spread is really for everyone in the room, not just the person who's there.
Thank you. I'd like to ask Angelika to share a little bit about kind of just some common client or family feedback that you've received after doing sessions with the client.
Of course, thank you. You know, I was thinking about this and I thought, you know, what's one word that would describe that feedback? And it would be gratitude. You know, gratitude to be able to experience the sense of peace that we talked about, whether it be family members or patients, clients. And you know, there's one thing that just came to mind as we were talking, and I wanted to share that experience with you. It was a client who was in hospital, who had lung cancer. And as I said, I work with a lot of cancer patients, and he was at the stage where he could barely breathe. And he was part of the hospice that I used to participate in. And he asked for me. So I went, and his whole bed would shake in his effort to try and breathe. That's how the cancer had taken over. He could barely breathe. And it was really, in essence, a bit difficult to watch. But, you know, getting centered and grounded and bringing that love essence to him. And really just doing the energy, whatever I was guided to do. I quite honestly don't recall what I was guided to do, but I remember the bed just like shaking as he tried to breathe, and then his whole body going into a state of, I'm going to say, stasis. It was like he, you know, when we can sometimes meditate, we go into this quieter sense of breathing. And he found that sweet spot. He was able to relax and let go and actually get the breath he needed before he passed. And it's those kind of situations where, you know, he couldn't even speak anymore because he just didn't have the energy. But you feel the gratitude that these patients, clients have for having that experience, to find that sweet spot. And then also what's happens doing this work, as we can all attest, is that, you know, we talk about relationship cords, that there's an actual energy cord that is created because we are in essence in relationship with these people that we are working with. And often when I would leave a person after doing a session, there's still the sense of connection. And I would always know when they passed. So I would be at home and They would be where they are. And I would, through this energy cord, receive this message that they've passed. And then I would get the phone call. And of course, I already knew. So that's another thing that I thought would be worth sharing, that you have this beautiful connection, because we talked about, not taking on their issues and their stuff, which is a good point to make. But there is this healthy sort of energy cord that's a loving relationship that does stay in place. And then I'll finish off with, ultimately, that whether it be family members or clients or patients, that this sense of peace that people so long for, to be able to find that before they pass is such a gift. It's just such a gift. So those are some of the things that I wanted to share with you.
Thank you, Angelika. And Dan, would you like to add to that?
Sure, Angelika, that was beautiful. That connection is, such a treasure. And quite often, I get the phone call also. It's like, oh yeah, I already know, they've passed. Because I think what they do is they let us know, and that's their form of gratitude, is like, oh, thank you for holding space. Thank you for showing me where I was supposed to go. Because sometimes that's all we need to do, is just, hold them. And let them feel that, all is well. One of the most common feedbacks that I get from clients is, their release of fear, and then obtaining the overwhelming sense of calm and that all is well. I talked about trying to, separate our stuff from their stuff. And what I meant by that is, sometimes the soul gets confused and dumps things energetically on whoever is there and able to hold that for them. But it's not ours to keep. We just let that go. So, with that being said, remote energy sessions work. When I pull up in the car, I prepare myself for whatever is, I'm about to experience, whether it's, chaos or whatever. And I do a little ritual, and then the energy of love and peace starts radiating out. And then the moment you walk in the room, everybody can feel that. And that's kind of what we bring, is that peace, the love, the unconditional love. And that energy tends to diffuse all the chaos and the panic and the fear and the unknown and the, all that other stuff. Regardless of what's happening around us, whether or not the person's, struggling or whatever. I recently went on a visit where someone, it was part of an 11th hour team, and they were having agitation, which is, that's a pretty recognizable last stage of end of life. And they were surrounded by like a dozen people all around the bed watching her suffer. Keep in mind that our perception of suffering is a lot different from what the person who's going through our perceived suffering really is experiencing. It's my experience is that they're releasing energy, and it manifests as what we perceive as suffering, whether it's moaning or gasping or groaning or whatever. So I went in there, calmly held her hand, placed the other one at the base of her skull, and she calmed down almost immediately. And when that happened, I started weeping. So I was holding her hand, holding her at the base of her skull, and I started weeping almost uncontrollably. Her agitation was grief, and what she was grieving was everything. She was grieving loss of life, loss of loved ones, loss of everything she's ever done in her life. And that was expressing itself as agitation. I was the conduit for that, and it just kind of let everything flow. It was really beautiful. When I stopped weeping, I disconnected. She was at peace. Everyone thought that I got so emotional, and I explained that, you know what, that wasn't mine. That wasn't my grief. So she just kind of let it all go, passed through me with ease and grace. And then after that, you know, we all just took a break. We went into the other room, we talked, answered questions. I reassured them that she's fine and that her suffering as we know it was not a big deal. Talked for a couple hours. They had all kinds of questions as to, you know, what I was doing energetically and all this stuff, which was great. So the feedback that I was getting from them was that, you know, like Angelika said, the whole room went calm. Everybody was at peace. Chaos was dispersed. And when we went back to check on her, she had a peaceful look on her face and she was gone. So, you know, it was, she got rid of what she needed to get rid of. She dumped it. She was at peace. Everyone in the room was at peace. And it just, you know, the beauty of this work is, you know, like all of us have mentioned, is sometimes overwhelming. I quite often cry, but it's not because I'm sad. It's either I'm helping them release something or I'm overwhelmed by the joy and the presence of all the beings that come to greet them as they transition. That's about all I've got on feedback. So thanks, Christine.
Thank you, Dan. I'd like to share just a brief experience that I had and interesting client feedback. I had a patient or client that her daughter was actually a Reiki master. And so I came to her apartment, is at a retirement community. Her daughter was there. I taught her the chakra spread. We did it together. It was beautiful. I left the room shortly after, and in the morning, the daughter called me that her mother had passed. And what she told me was, after I had left, her mother had a really severe lung condition. So she was struggling to breathe, difficult to speak, but she could kind of speak a little bit, and they, you know, could understand. That her mother had told her after the chakra spread that she actually could feel her spirit lifting. But she wanted to wait until her son came. So she was able to wait until her son arrived and then passed shortly after, which was like 3 hours after we did the chakra spread together. And the daughter was just so grateful. Just so grateful that I taught her this technique, that I was there, that I was able to give this gift to her and her mother. And it was just beautiful. So I just wanted to share that. So as far as plans that you make with your clients or perhaps the client's family, following a session, referrals, self-care, those kind of things. And perhaps even, you know, if you want to talk a little bit about self-care for yourself, Linnie, if you wouldn't mind talking about that. Oh, you're on mute, Linnie.
I'm still chuckling when you talk about plans, because I'll be doing the intake and I'm thinking, well, this would be a good idea this week. I'll do this, 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 and this. And I can hear my guides laughing. You know, there's the old adage that when you make plans, God laughs. And in a way, I can't make plans because usually I'm called in within 6 weeks of when somebody passes. And so there isn't like a long-term thing with an illness where you might see them for a long period of time. And usually I see them about once a week, but it depends upon the needs of the client. And it's really very important to listen either on an intuitive level, family member level, or if the person is lucid, talking with the client themselves. What do they need? What do they want? what kind of care do they need? And then that passes on to the family as well, especially when it comes to self-care, because family and friends tend to neglect that quite a bit. Also, when it comes to self-care, it's very important when I leave the room to make sure that I have separated myself from the event that's been going on, so that I'm not carrying all the emotions that are going on with the person who's making their transition. I learned that right off the bat because I'm very empathic and I was carrying a lot of stuff that I didn't need to. And I think, Melinda, you even took some of that off of me once when we were working together. But I wanted to share an experience about referrals. My grandmother went into a coma when she was getting ready to make her transition. And she had been raised a Methodist, but when she married my grandfather, he insisted she become Catholic because that's what he was. So she joined the Catholic Church. And when he left, she disavowed the Catholic Church and wanted nothing to do with it and went back to the Methodist Church. But she seemed to be lingering on. And as a family unit, we all got the message at about the same time to refer her to a Catholic priest. So we brought him in and he performed the last rites, and 8 minutes later she passed. So it's important when you're thinking of referrals, what's needed. A lot of listening needs to go on during this time so that you can determine what each person involved with this experience needs. There is I don't know what it's doing now, but because it's been 5 years or so since I've done a referral, but there is a group in Portland for children who have experienced the loss of a parent or a very close family member, where they can go and talk it out. I don't remember, I can look it up, I can find the information if anybody wants to know what it is. It won't do you any good unless you live in Portland, but there are services available all across the United States just for children who have lost a loved one. And I have made that recommendation a few times when somebody's been making their transition. Usually it's a grandparent, but even so, it's a difficult time for children, and they tend to get neglected a bit during this time. And cast aside, or they're not allowed to be present. Or I bless the families that include the children and everything and talk about it all the way through about what's happening, but that's not very common. What else did I want to talk about on this? How about let's open it up to somebody else who has some comments on this subject. Somebody else want to say something?
Yeah, if there was anybody else that wanted to add anything, if not, we can move on to success stories. Okay. So, and many of you have kind of shared some, stories throughout, but I'm wondering if Donna, if there's any particular story that you wanted to share with us.
The one story that came to mind when this was brought up is a story about a hospice patient. I received a call from one of my hospice colleagues, and this particular patient was at home with her daughter and her husband, and she had been actively dying for several weeks, but she was exhibiting a lot of emotional and physical pain, and it was really distressing the husband and the daughter very much, and they couldn't understand what she could have possibly been holding on for. So my colleague called and asked me to come and see the patient. And when I went, she clearly was just balled up. There were so many decubiti across her body from being in this position. She had lost so much weight and was so cachectic that there was really nothing left to her, but she clearly was moaning and crying out. And so I did a very brief discussion with the family about healing touch and the chakra spread, and both the husband and the daughter remained in the room as I performed the chakra spread with the client, and we watched as she settled down. The whimpering stopped. She seemed to be at peace. And she did transition that evening. And to add a little light to the other side of the story, my colleague came in the next day and I was sitting there documenting, and she said to me, so what is the opposite of the angel of death? And I said, excuse me? She says, my patient died last night after you saw her. What is this? And I said, I'm not the angel of death. It's just the work that we did. It's what we do. We help people transition on this earthly plane. And it was her decision to leave, not mine. We just added a little bit of, permission for her to go. And so it was kind of interesting the way that she came in about it, because the colleague had never experienced anything like this before. And she'd been a hospice nurse for quite some time and was taken back that the patient had the response that she had after receiving the session. So anyway, that's my success story, if that makes any sense to you.
Yeah, thank you, Donna. And Angelika, was there a story you wanted to share?
Yes, I'd like to share the story about my mother-in-law passing, which I did mention before we put the recording on, but I think it's worth sharing again. It's my mother-in-law was very, very, very afraid of dying, and she was also in a lot of pain. She was suffering, and she kept asking every day, like, why isn't God taking me? I'm asking to leave. I want to leave, but yet I can't seem to leave. But she did have this inner fear of where she might go, and she wasn't very religious, so she didn't really know what would happen to her, and I think she thought something pretty horrific might happen to her when she died. And it's worth mentioning too that my relationship with my mother-in-law was not through language, because she spoke French and I speak English, and neither one of us could speak the other language. So throughout our entire relationship, I have to say it was very energetic. So when I would visit her, I would simply be in the room with her, and I would love her and speak to her energetically, not through words. And the odd time, of course, we had a translator, which would be my husband, but many times I would just sit there, and she often would say, I'm this angel that arrived to be with her. And she would say things like, Angelika really, really loves me, and Angelika doesn't judge me. And she would say these things, and there was no verbal communication. It was all energetic. So, I think this is really worth mentioning. So as I was able to see her just before she passed, walked into the room, and my husband decided that he needed to go out somewhere. I simply took her hand and I kneeled down beside the bed, and I started to do something called light language. It's sound healing. It's using the voice, in this case, using the voice. And I want to bring this in because the sound of the voice, whether you do channeled light language or you're simply talking, from your heart, from your own soul, and saying something to the person, is so profoundly healing in itself. The sound of the voice, and the voice has many layers to it. It's like energy. We have many layers to our aura. Well, your voice has many layers to it, some that we can hear with our ear and some that we can't, but we can feel. So that I started to channel this sound. And it was really the songs of her soul, what I call the songs of her soul, to help her, free her of this fear of letting go, to pass. And it wasn't very long. It was very short. And she was very, in a state of, you could see she was already starting to go. And she just moved her head forward, like she put her ear towards my mouth, because she could hear. And I don't know what she heard, because like I say, it's many layers of sound, and sound is simply energy. We have to remember that it's energy. And it helped her to release that fear. And she went into this deep state of peace. And then I kissed her goodbye. My husband came back. He experienced the tail end of it. He said it was so beautiful. And then we went home. And we didn't live close by. And we got the call the next day that she had passed. And I was so grateful to have been able to have that experience with her, for her, but also for me and for my husband. And so, yeah, I just wanted to share that as I mean, success story is kind of a funny word, right? When we're talking about death, but certainly, you know, such gratitude that we can connect energetically. It's so powerful. And I would just want to say, to end it off, that often we don't know what that person has experienced, right? We think we might know, but often we don't know the depth of what that person has experienced energetically. Yeah.
Thank you, Angelika.
Welcome.
Melinda, was there a story that you wanted to share? And you're on mute.
Thank you. I'm like Linnie. I get so excited. I'm just ready to jump out of the gate here. I want to offer a gift to those that are in that environment and able to work at end of life. Because my intuitive gifts and my intuitive knowledge and information has grown so exponentially when I'm in that, standing at that veil, I like to play with spirit a little bit. And so when I'll give you an example. The first woman who passed when I was working with her and doing a chakra spread, they did not know why she was hanging on. Young woman, rather big woman. And so when I'm working with a client, I will ask them if they could show me or tell me or give me a picture of something that tells me they've made it to the other side. And I do this all the time now. And with this particular woman, you can't make this stuff up. She showed me an Oreo cookie. I'm like, okay. And she was a rather large woman. And so she passed in the middle of the chakra spread. And a few days later, I'm finding about 3 days is about when I get a sign from them that they've made it. So I was in Colorado at the time, and I walked into a local supermarket. And when I walked in, was the largest display of Oreo cookies I have ever seen. And I've never saw that again. And so I invite you, when you're working with spirit, if you are interested in knowing that they have arrived and that they, you know, and they do arrive. It's not if, they do arrive. My father sends me golf balls. My grandmother sends me pennies. I have another grandmother that finds parking spots for me. Ask spirit, ask the soul what it is that, you know, they want to show you that they have arrived. It's, I don't know. I just like to have fun with that. And every single time I am gifted the knowing of something that they have been passionate about. And I know that they have made it to the other side and they're still there, right? I don't ever, like, I think Linnie, we were talking about that before everybody arrived. The body, of course, dies, but that soul always lives on, and they are continually communicating with us if we're open and listening to them. I think the fear is that we can't have that communication and that connection after the body has left. And I continue to this day, when I see something a patient has showed me, I always think of them. And so it is a gift to you folks that if you have that, if you remember to ask them, you know, for that sign, they will show you. So.
Thank you, Melinda. So I do know we're coming to the end of our program here. So anyone that needs to jump off, feel free. We will continue to record and you can catch it later. But Dan, is there anything you wanted to share as far as challenges that you have faced when working with someone at end of life, or just anything else that hasn't been mentioned that you think is important for people to know?
Yeah, sure. Thank you. It's important to remember intention over technique. You know, we're taught that in healing touch. Follow the energy, intention over technique. End of life comes in a variety of places. Sometimes it's a lovely home. Sometimes it's a hospital. Sometimes it's an institution. Sometimes it's a homeless shelter. So I believe the biggest challenge that we have is our own, and that's being heart-centered, present, non-judgmental, calm, peaceful, no matter what chaos or drama we meet. So being able to do the work without any outside indications like pendulums or hands in motion or any of the other methods, we need to be able to do those with intention alone. Because, for example, I was asked to come to a homeless shelter here in Denver, and the person who was transitioning was on a cot in the middle of the Coliseum, surrounded by 300 other cots and men just, mingling around. And this lovely soul was in the middle of a transition, and I was being asked to be of assistance. So, I couldn't do assessments. I couldn't do chakra spreads. All I could do was sit with him, and that was enough. So Melinda, you mentioned before that when you walk into a space and you just know, it doesn't matter where that space is. It could be in the middle of a homeless shelter surrounded by people who are, devolving and, having psychotic episodes. The sacredness of the moment with that individual person overwhelms everything else in the room. So bottom line, as I see it, get your field in order, be grounded and centered, ask your guides for assistance and protection, leave your stuff outside, leave their stuff inside, and with pure love and intention, you can't do it wrong.
Thank you, Dan.
Christine, I have a point that hasn't been brought up yet.
Sure.
That has come up several times, but the best story is with my mother-in-law. Her early life was Southern Baptist, all hellfire and brimstone. And we discovered when she reached the end of life that she was absolutely terrified of dying, sure that she was going to go to hell. So my sisters-in-law and I were holding her hands and talking her through, and she made her transition, or at least that's what they thought. And after the family left and they had removed the body, I knew that she was still in the room. She hadn't left. So I went and I sat down on the bed beside where I knew her spirit was. And I talked to her about there is no hell. She wasn't going to go. She was one of the kindest, most beautiful women I've ever met in my life. And then I brought down the white light and I asked her parents to come down to help guide her through. So it is something to know that sometimes you'll have a client who doesn't leave right away. And if you can be sensitive to that and help them make that final step, it's important. So that's what I wanted to say.
Yeah, thank you for sharing that. So if anyone has, we can maybe do a couple questions. If anyone has a question that they want answered, please go ahead and put it in the chat. I do want to say that all of our speakers today are in the practitioner directory on the Healing Touch website. So you can, if you have a specific question for anyone on the call, you can contact them that way. There was one question that I saw earlier. Someone was asking if any of you have ever used the mind clearing technique when you feel that someone is struggling.
So basically, when I hold the back of the head, it's almost a modified mind clearing without using all the different positions. So it helps them release, whatever no longer serves them.
Great, thank you. Anyone else? Linnie, I saw you nodding. Have you done the mind clearing on someone who's struggling?
Yes, although I do it from the side, I don't, so often they leave through the crown chakra. I don't want to be in it to block the passage. So I'm kind of doing it from the side. But you know, mind clearing relaxes us and relaxes the chatter in the mind and that intellectual part that can get in the way of somebody's deciding that it's time to go. And doing mind clearing sometimes can really clear that. Usually that's maybe a session or two before they pass, but sometimes it's very close to when they make their transition. And it's a beautiful experience. It really is.
Thank you. I just see one other question here. Someone says that sometimes she notices that the exit portal appears and then it is gone later. Is this the client's willpower closing it down? Can anyone speak to that?
I mean, I think that is an individual practitioner experience and awareness. I've never experienced that. I have to say, I don't think I've looked for that. And so I think if that is what you're seeing and sensing, that is what is being shown to you and that particular dying person's energy signature as they're leaving. I have to admit, though, I learned something on this call. I would have never thought to do a mind clearing. Thank you. I would have never thought about that. I think that's, we have so many head cases anymore. You know, a lot of people are in their thoughts, and what a wonderful gift to clear that and open that part of the system in order for them to release and let go. I think, Dan, that's, you know, awesome to share that.
Great, thank you. I think we'll end our call here. Thank you so much for all of you that participated in today's event, and a very special heartfelt thank you to our lovely 5 speakers. I certainly enjoyed hearing about all your experiences and stories and wisdom. And I trust that everyone on this call and everyone listening to this recording later did as well. So Donna, Melinda, Angelika, Linnie, and Dan, thank you so, so much for volunteering your time and sharing your knowledge with us to help us all in our practice and to better serve our clients. If you enjoyed this event or have suggestions, I would love to hear your feedback. I'm going to put my email address in the chat. Our next Healer Development series is going to be on cancer. And we have a wonderful panel of 5 speakers for that topic. It'll be on Friday, February 4th at 12:30 Central. I will send the registration information through email. It'll still remain a free event for HTPA members and $50 for non-HTPA members to attend. And then finally, if you are a certified practitioner or an instructor and would be interested in being on a panel for a future topic, please feel free to reach out and email me. Thank you again for being a part of today's event. And thank you for all the healing that all of you bring to the world. Thank you.
Thank you.